Hi, I'm Senator Pat Toomey. You know, it's been amazing to watch how Americans have responded to this coronavirus, how people have pulled together and volunteers are doing amazing work. And of course, our healthcare professionals are just heroes in this battle. But sometimes people ask me, what can I do? What can I do personally to help? And there is something that I think we can all do to help slow down the rate at which this virus is transmitted among us. You may be aware that on social media, trending now is Masks for All. I think it's a really important and really constructive idea. Let me be clear, I'm not talking about the high quality, surgical quality masks that we need to save for healthcare professionals, the people that we know are coming in contact with people who have this virus. Until we have much bigger supply, we've got to make sure those really high quality masks are reserved for healthcare professionals. But for the rest of us, you know, there is something that we can do. We all know, and we've all hopefully observed, that if you sneeze or you cough, you sneeze into your arm and you cover your cough. And that's for the obvious reason that we don't want particles that are leaving our mouth or nose to possibly infect someone else. You know, many of us could be walking around with the virus. Maybe we have no symptoms. We may never get the symptoms, but we might be able to transmit the virus. And all the science suggests that one of the most common method of transmission is the little droplets of fluid that are emitted when we sneeze or cough. So here's what I think we ought to do. First of all, we should follow what our governor here in Pennsylvania has indicated, and that is in some places, including where I live in Lehigh County, we're in a shelter-in-place mode, and so we shouldn't leave the house except for when we really need to. But there will be times when some of us will need to leave our homes to go to the grocery store, to pick up medicine. There inevitably are going to be needs to be outside, and while we can and should continue to observe the social distancing that is a really important part of reducing the rate of transmission, we also could be wearing just a homemade mask or even just a bandana, something that we can put over our nose and mouth so that we reduce the likelihood that droplets from our own breath would inadvertently be inhaled by someone and thereby potentially infect them. Masks for All. It's a great idea. It appears to have been deployed very successfully in the Czech Republic. I would encourage people to make sure if you're going outside, cover your nose and mouth. It's, you know, my mask will keep someone else safe and their mask will keep me safe. I'm not suggesting that this is any kind of guarantee, and it probably doesn't have tremendous value for the person wearing the mask, but it probably does significantly reduce the risk that people could inadvertently transmit it. I'll have more information on my website, but Masks for All, I think, is a really good idea.